Dr. Sarah Chen had spent 8 years perfecting the art of invisibility, not the kind that escapes notice. She was a trauma surgeon at St. Helena General, respected and precise, but the kind that leaves no trace. Her hands moved with mechanical grace through emergency bays. Her voice remained level during codes. She never answered personal questions. Colleagues assumed she was simply private. What they didn't know was that every steady breath she took was a discipline learned in places that didn't exist on official maps. The residents whispered about her hands. They didn't shake, not during a 3 a.m. gunshot wound. Not when a child arrived with injuries no child should survive. Not when a patient coded on the table and every second meant the difference between heartbeat and flatline. Her hands moved like they already knew the answer before her mind caught up, because they did. 12 years as a combat trauma surgeon in classified operations had taught her that hesitation kills. Doubt kills, emotion kills. Only muscle memory and certainty save lives. But certainty has a cost. Sarah carried it in the tight jaw she maintained during lunch breaks. In the apartment she returned to each night. Bare walls, no photographs, no history, in the way she flinched at helicopters and avoided crowds. In the dreams, she no longer bothered to resist. Then, on a Tuesday in November, 3 men in dark suits were wheeled into St. Helena's trauma bay with injuries that made the paramedics go silent. And Sarah's invisible life ended in the time it took to recognize one face. A face she thought she'd never see again. A face that knew exactly who she was. Chapter 1. The Hands. The alarm screamed at 11:47 p.m. Sarah was in the physician's lounge, holding cold coffee and reading a journal article on thoracic vascular repair, the kind of clinical distance that let her pass the evening without thinking. The overhead announcement fractured that distance. Trauma alert. 3 critical incoming. ETA 5 minutes. She set down her coffee, didn't hurry. Hurrying signaled panic. Instead, she moved with the same unhurried precision she'd learned in field units where the loudest person died first. Gloves, mask, the ritual of preparation that turned a human being into a vessel for competence. The ER bay was already chaos, controlled chaos, but chaos nonetheless. Nurses moving between bays, the respiratory therapist testing equipment, the surgical residents gathering, uncertain, waiting for Sarah to arrive and make sense of confusion. "Talk to me," she said, arriving at the first bay. "GSW, gunshot wound, left abdomen, entry and exit," the paramedic reported, a practiced recitation. "Vitals unstable, BP dropping. We've got 2 units running." Sarah's eyes moved across the patient's body like she was reading a map. The wound track, the angle of entry, the probability calculations that happened before she was conscious of making them. She'd seen this before, not in a hospital, in a bunker outside Kandahar, in a desert compound where the distinction between medical practice and triage became philosophical rather than practical. She glanced at her hands. They were steady. They were always steady now. "Get him to the OR. Prepare for exploratory laparotomy. Call vascular. We'll need them standing by." She moved to the second bay without waiting for confirmation. The resident trailed her like a shadow. "Dr. Chen." "Observation only," she said quietly. "Watch how I move. Notice what I'm looking for. Don't speak unless spoken to." The second patient was worse. Trauma to the right thorax. Compromised airway. Sarah could see it in the pattern of the injuries. These weren't random. These were precise. These were inflicted by someone who knew how to hurt without killing immediately. Someone who wanted information before they let someone die. She was so focused on the wound pattern that she almost missed it. The third bay, the figure on the stretcher, face partially obscured by oxygen mask and trauma tape. But she knew that profile, that particular scar tissue on the left side of the jaw, that exact configuration of the clavicle visible beneath the torn shirt. Her hands, for the first time in 8 years, hesitated. It was only a fraction of a second. Invisible to everyone except the one person who would recognize it for what it was. Not medical uncertainty, but recognition. Personal. Dangerous. Forbidden. Her hands steadied again. The hesitation vanished like it never existed. "Get him intubated and to the OR," she said, her voice exactly as it had been seconds before. "All 3 go now. Activate massive transfusion protocol." But as she turned toward the surgical suite, she made the mistake of meeting his eyes, the third patient's eyes, the ones she'd hoped never to see again. And in that moment, she understood. This wasn't coincidence. This was someone from her past, bleeding on a stretcher, about to learn exactly who the quiet trauma surgeon in the corner used to be. Chapter 2. The residence, Dr. Marcus Webb, had been a trauma resident for 18 months. Long enough to know he was still learning. Short enough to still believe that surgical skill was primarily a matter of training and aptitude. He'd worked under Sarah Chen for 4 months. He was beginning to understand that something else lived beneath her technical precision, something that had nothing to do with residency programs or attending lectures. He watched her move through the first surgical case with an efficiency that transcended normal practice. Most attendings explained their steps. "Here, we're checking for vascular injury. Now we're irrigating. Notice the perfusion line here?" Sarah didn't explain. She simply acted, and her hands moved like they were operating from muscle memory written in a language Marcus couldn't quite decode. By the third incision, he realized something. Sarah wasn't thinking. She was remembering. "Clamp!" she said. And the surgical nurse, who'd worked with Sarah for 3 years, handed her the instrument before the word fully left her mouth. They moved like parts of a single organism. No hesitation, no consultation, just action and response, action and response. An almost hypnotic rhythm of cut and repair and precision. The patient, GSW to the abdomen with what looked like a deliberate entry pattern, had injuries consistent with someone who'd been interrogated with violence. Marcus knew this because Sarah's eye movement told him she was seeing that too. Something flickered across her face, so quickly he might have imagined it. Recognition, maybe, or memory. "What's her story?" he'd asked Chen Park, the senior resident, during a break between cases. Chen Park was washing her hands, moving methodically. "Dr. Chen? Yeah, she's incredible. But there's something, I don't know. Like she's not actually here sometimes. Like she's running on autopilot." Chen Park had looked at him with an expression Marcus couldn't quite interpret, something between pity and recognition. "She's a trauma surgeon. We all run on autopilot after a while. The alternative is falling apart." "That's not what I meant." "I know what you meant," Chen Park said quietly. "But if you're smart, you'll stop wondering about it. Some people come to trauma surgery because they want to save lives. Some people come because they're trying to save themselves. With Dr. Chen, I've never figured out which one she is, but I do know this. Her hands don't shake when everyone else would be trembling. And in this job, that makes her either a saint or someone who's seen too much to be broken anymore." Marcus had nodded, but the answer didn't satisfy him. There was something in Sarah's past, something she carried the way some people carry shrapnel, embedded too deep to remove, so you just learn to move around it. By the time he was assisting on the third case, the patient with the thoracic trauma and the face Sarah had recognized, he thought he understood a piece of it. Sarah made a call that violated protocol. She ordered labs that weren't indicated. She asked for security to position someone outside the patient's recovery room. "Dr. Chen," he'd said carefully, "that's not standard post-op procedure." She'd looked at him with eyes that seemed to see through him to something beyond. "Some patients are worth protecting," she'd said quietly. "Standard procedure is for people with standard problems. This is neither." Chapter 3. Silence. The recovery room at St. Helena General was designed to be sterile. White walls, beeping monitors, the smell of antiseptic layered over something metallic that might have been blood or might have been fear. Sarah sat beside the third patient's bed at 3:47 a.m., watching him wake from anesthesia. His eyes opened gradually, consciousness reasserting itself like a hand breaking through water. For a moment they were unfocused. Then they found her. Then they went very still. "Marcus." His voice was rough from intubation, fractured from pain medication. "No talking yet," Sarah said quietly. "Your lungs need rest. You had a pneumothorax. Repair went clean." He tried to speak anyway. She held up a hand, not harsh, just certain. He obeyed, which told her everything she needed to know. He was trained like she was. Obedience to a quiet command was reflex. She adjusted his oxygen, checked his vitals, performed the routine actions that gave her time to think about what she was seeing. His face was older than she remembered, harder, scarred in places that didn't show in photographs. But the core of him, the way he held himself even unconscious, the way his eyes tracked her movement even through pain medication, that was unchanged. "The other two?" he asked when she returned to check his line. "Stable. Vascular team is watching the first patient. The second has a fractured rib and lung contusion, but nothing that won't heal." He closed his eyes. Relief, probably, or something that looked like relief. Sarah pulled a chair close, sat, let the silence settle between them like dust. "How long?" he asked eventually. 8 years, 3 months. He opened his eyes. "You kept counting?" It wasn't a question. She didn't answer it anyway. "Why?" he asked. "Why the hospital? Why here?" Because I needed to remember what it felt like to save someone and have it actually mean something," Sarah said quietly. "Not because of orders, not because of strategy, just because a human being deserved to live." He was quiet for a long time. The monitors beeped their steady rhythm, the sound of a heart still working, still fighting, still refusing to stop. "They sent us after you," he said finally. "Didn't know you'd ended up here until the operation went wrong. That wasn't supposed to happen." "What wasn't?" "Any of it. We were supposed to extract a target from a safe house 2 blocks from St. Helena. Something went wrong. Ambush, maybe, or a setup. Orders came down to abort and extract." He looked at her. "We got cut off. Only choice was to come here. I looked at the roster, and I saw your name, Dr. Sarah Chen. I wasn't sure. 8 years is a long time. Long enough to become someone else." "No," he said quietly. "Long enough to pretend. There's a difference." Sarah stood. "You need rest. I'll come back in the morning." "Sarah." She paused at the door, didn't turn around. "Thank you for not letting us die," he said, "even knowing who we were." She left before he could see her hands shake. CTA, end of chapter 3. Comment where you're watching from. Let's see how far the stories of real courage and silent sacrifice can travel. Chapter 4. The Protocol. The problem with secrets is that they create their own physics. They demand energy to maintain. They require constant small lies that compound into larger ones. By the following morning, Sarah was running on the fumes of exhaustion and discipline, neither of which was enough to stop the unraveling. The complication began at rounds. Dr. Harrison, the attending physician overseeing the ICU, had questions about her protocols for the 3 patients. "Extra security?" he asked, flipping through charts. "That's unusual." "Precaution," Sarah said. Her voice was level. This was something she'd practiced, the art of partial truth that sounds like complete honesty. "Against what?" "Infection risk. The first patient's wound shows signs of contamination that might suggest environmental exposure. I want him isolated." Harrison looked at her. She could see him calculating. He was a good physician, competent, thoughtful. The kind of doctor who noticed when something didn't add up. The wound pattern, he said slowly, looks more like trauma than infection, and the security request came before culture results. Sarah met his eyes. I have a gut feeling about this case. You taught me to trust my instincts. Harrison smiled slightly. I taught you to back up your instincts with evidence, Chen. What am I missing? This was the moment, the fork in the road where she could maintain the fiction or begin to speak truth. She chose a middle ground, which was probably the worst possible choice. They're not ordinary patients, she said quietly. I can't tell you more than that, but I'm asking you to trust me. Keep the security in place. Keep them separate. Don't ask questions about their background. Are they in danger? From what? Hospital-acquired infection? From people who might come looking for them? The words hung in the air like a confession. Harrison set down the chart. Do I need to call hospital administration? Not if you trust me. I do trust you, Sarah. That's the problem. Trust means I can't just pretend I didn't hear what you just implied. He paused. Are these patients wanted by law enforcement? No. Are they a security risk to the hospital? No. Are they going to cause problems for St. Helena? Sarah thought about it. 3 intelligence operatives bleeding into trauma bays. One of them, the one with the scarred jaw, who'd known her name before consciousness had fully returned. Yes, problems were coming. She could feel them in the same way she used to feel incoming fire in the desert, a vibration in the air that meant things were about to change. Probably, she admitted. Harrison studied her. Then, to her surprise, he nodded slowly. I'll keep the security. I won't ask questions, but Chen, whatever this is, it's going to come out. These things always do. I know, Sarah said. I just need it not to come out yet. Why? Because they're not stable enough to be moved, because if whoever wanted them dead finds out they're here, this hospital becomes a battlefield. Because I spent 8 years trying to be someone who saves lives without blood on her hands, and I'm not ready to admit that person was always a fiction. Because they need time to heal, she said simply, before anything else happens. Chapter 5. Questions. By the 3rd day, Marcus Webb had stopped pretending not to notice the inconsistencies, the security detail that materialized without explanation. The patient in room 412, Marcus's patient, the one with the thoracic trauma, asking for Dr. Chen specifically and getting visibly tense when any other physician approached his bed. The way Sarah moved through the ward with a new tension in her shoulders, like she was waiting for something. It culminated when he found her in the supply room at 6:15 a.m., hands shaking as she restocked a crash cart. Dr. Chen. She didn't startle. That told him something, that she'd heard him coming, that her consciousness was deployed in ways most physicians never developed. Yes, she said, not turning around. Those patients in 412, 413, 414, who are they? Patients, like any other patients. No, Marcus said. There's something else. The way you interact with them. The protocols that don't match any standard care. The security. He paused. The way that one patient looks at you like he knows you. Sarah turned. Her eyes were exhausted but steady. Some things are classified for a reason, Dr. Webb. Because they're illegal, because they're dangerous. So you do know them. Sarah was quiet. Then, I knew them a long time ago, in a different context, in a different country, in a different life. Are they? What were you? A combat trauma surgeon, Sarah said quietly, for the military. For operations that don't officially exist, attached to units that don't have names, working in theaters where the distinction between medicine and warfare becomes unclear. Marcus felt something shift in his understanding of the world. And now, Now I'm a civilian physician. Those patients are civilians too. That's all that matters. But someone wants them dead. That's why the security... I can't discuss this with you, Marcus. And if you're smart, you won't ask anyone else about it. These waters are deep, and they'll drown you if you step into them. Chapter 6. The Three. The confrontation came during evening rounds, when hospital security informed Sarah that visitors had been asking about 3 specific patients. Men in suits, not family, not social workers. Just men asking questions and showing interest in floor plans. Sarah was moving toward room 412 when she saw them, not the visitors, but the consequence of their arrival. The 3 patients had been moved to a private wing, not by her order, by someone else's, someone with authority that superseded hospital protocol. She found the one with the scarred jaw sitting upright, his catheter removed, his dressings fresh. His name was Michael. That much she remembered. She also remembered he'd been a specialist in extraction operations, the kind where surgical precision about target removal had nothing to do with healing. "They know you're here," she said without preamble. "I know. Found out this morning from my handler." "Handler? You're active?" "Semi-active. Consulting mostly. The other 2 are still operational." Michael looked at her. "We were supposed to be in and out. 12 hours, extraction done, home by Thursday. Something went wrong with intelligence. The safe house wasn't safe." "So you came to the nearest hospital?" "The nearest trauma center," he corrected. "We needed someone we could trust. We didn't have trust anymore, not in anyone. Then I saw your name on the directory and I thought, maybe." He paused. "You still could have let us die. You didn't. I'm a physician. You're more than that. You're someone who knows what we are, someone who used to be what we are. That makes this complicated." Sarah sat. The monitors beeped their steady rhythm around them. "There are people looking for you," she said. "People with authority to move you, people who aren't necessarily interested in your recovery. The same people who probably set us up? Maybe. I don't know enough. But I know that if you stay here much longer, this hospital stops being a sanctuary and starts being a trap." Michael was quiet. Then, "Can you get us out?" It was the question Sarah had been avoiding. The answer was yes. She had resources, contacts, protocols from another life that she'd promised herself were over. The answer was also no. Getting them out meant stepping back into the shadows, becoming again the person she'd spent 8 years trying to kill. "Yes," she said, "but if I do this, I can't come back. St. Helena would be compromised, the residents I trained, the nurses I work with, the patients who come through that ER thinking they're safe. All of that becomes a liability. I'd have to disappear. I know. I have a life here, Michael, not a good one, not a happy one, but it's real. These patients are real. That work is real. I know that too." CTA, end of chapter 6. If this story has already moved you, hit the like button. It helps more people discover stories of compassion and duty. Chapter 7. Recognition. The decision came during a quiet moment in the 3rd patient's room. He was the least injured of the 3, blunt force trauma to the ribs and a simple pneumothorax. His name was David, and he'd been a logistics specialist when Sarah knew him. He'd also been the one who'd asked permission to treat Sarah's wound in Kandahar, a through and through in the left shoulder that she'd tried to ignore. "You saved my life," she said, not as a question. That was a long time ago. "You did it anyway. Against protocol. I was attached to a different unit. There were jurisdictional issues, chain of command complications. You treated me anyway." David smiled slightly. "You were bleeding. Protocol doesn't matter when someone's bleeding." "That's not what they taught us." "No, that's what they tried to teach us. I never quite learned it." Sarah stood at the window, watching the city lights reflect off rain-wet streets. The cinematic cliché of it almost made her laugh, the existential moment framed by weather and darkness. "I'm going to get you out," she said, "all three of you. Tomorrow night, there's a way." "The hospital? I know. But staying here is death anyway, just slower and involving paperwork." Chapter 8. The Truth. What Sarah hadn't told anyone, not Marcus, not Harrison, not the security team, was that she had a contact. A woman named Elena, who'd been a field surgeon alongside Sarah in 3 different countries and 2 different wars. Elena had retired differently. She'd built a network. Elena ran a clinic in the city's east side that officially treated the uninsured and undocumented. Unofficially, it was a way station for people who needed to disappear. Elena had called the night the 3 patients arrived at St. Helena, had known, somehow, that Sarah would eventually need to choose. The extraction happened with the kind of precision that only exists when people have trained together in violence. Sarah arranged for the 3 patients to be transferred for imaging studies at 11 p.m. The ambulance that arrived had legitimate credentials. The paramedics had legitimate certifications. Everything looked legal until it wasn't. Marcus found out when he came to check on his patient in room 412 at 11:47 p.m. and found the bed empty. He found Sarah in the physician's lounge, packing personal items into a bag, the coffee mug a patient had given her, a journal of research notes, photographs she'd kept of her time at St. Helena. Where are they? Safe. Beyond that, you don't want to know. You're leaving. It wasn't a question. Yes. Because you helped them disappear? Because I'm still the person I used to be. I keep thinking 8 years would change that. Time doesn't change what you are, Marcus. It just lets you pretend more convincingly. He watched her move through the room, collecting pieces of a life she was abandoning. For what it's worth, I think you're wrong. I think you're exactly what St. Helena needed. Someone who understands that saving lives sometimes means breaking rules. Sarah looked at him. That person gets people killed eventually. Better to remove myself from the equation. They'll ask questions. The hospital administration, law enforcement probably. Tell them the truth. 3 patients were transferred for additional care at another facility. Tell them I resigned for personal reasons. Tell them whatever makes sense. The important thing is that you don't know where they went. What if I do? What if someone finds out? Then you came under duress. That's the story. I used medical authority to move patients against their will, and you were following physician orders. That's not what happened. No, Sarah agreed, but it's what you'll say, because that's the difference between us, Marcus. You're still someone who can return to normal. I never can. Chapter 9. After the storm. The official investigation lasted 6 weeks. The conclusion was inconclusive. 3 patients transferred without full protocol. A physician who disappeared. Questions that led to more questions. The hospital implemented new security measures. Hospital administration issued statements about their commitment to patient safety. Within 3 months, the incident had faded into institutional memory, the kind of thing people referenced as "remember when" before moving on. Marcus completed his trauma residency. He thought about Dr. Chen sometimes. In moments when a patient should have died, but didn't. In moments when his hands moved with confidence he hadn't earned through training alone. In moments when he understood that medicine was sometimes about breaking rules to save lives. Elena's clinic received a donation of advanced surgical equipment 3 months after Sarah disappeared, no name attached. But Elena knew who it came from. Sarah lived in a small apartment in a city no one who knew her would think to look. She worked at a community health center under a different name, Sofia Martinez, and spent her evenings reading journals and training residents the way she'd trained Marcus. She didn't answer questions about her past. She didn't discuss classified operations. But when she was teaching a resident about thoracic repair, something in her voice suggested she'd learned the skill somewhere beyond a residency program. Michael, David, and the third operative, the one whose name she'd learned was Thomas, disappeared into the machinery of intelligence work. Sarah never heard from them directly, but 6 months after the extraction, she saw a brief mention in an international news feed about a successful hostage rescue in Southeast Asia. 3 operatives, minimal casualties, professional work. One night, reading this news, Sarah found herself thinking about duty, about the difference between serving a system and serving humanity, about whether an 8-year attempt at redemption through civilian medicine had been genuine or just another form of hiding. She didn't have an answer. But the next day, when a patient arrived in her clinic with injuries that looked suspiciously like they came from violence that wouldn't be reported to authorities, Sarah treated them with the same precision she'd once used in field units. And when that patient later referred others, people who needed medical care without questions, Sarah understood that she'd never truly left her old work behind. She'd just found a way to make it legal. The monitors in her small examination room beeped their steady rhythm. Outside, rain fell against the windows. At 3 a.m., when she was reviewing charts and drinking cold coffee, she caught her reflection in the dark glass. Her hands were steady. They were always steady now. But she'd stopped believing that steadiness meant redemption. It just meant she'd learned to live with the weight. Epilogue. Some scars heal beneath the surface, where no one else can see them, and the quiet work of compassion becomes the only prayer left.